Hello, everybody. Thank you for joining us today for a great webinar where we are going to be talking about many facets of aging. And I am just going to give it a few seconds for the rest of our guests to get into the room. They are coming in. Again, welcome everybody. Housekeeping, your chat is open if you would like to go into the chat and you can tell us where you're from, who you are, and we're so happy that you're with us. I am going to be introducing our panelists one at a time as they are speaking. So I will introduce them as their speaking turn comes up. Um, I think at this point, I'm going to go ahead and get started. We are at 4:01. My name is Catherine Cerulli. I am the director of the Susan B. Anthony Center, and I am very pleased to be here today with my community partners. The webinar today is about addressing inequities. We've held several in the past around things like homelessness, maternal health, food deserts, and we are excited today to be bringing three over the course of June that will be dealing with aging. This webinar is being recorded and we will be providing it to our YouTube channel should you seek to use it for your own purposes, your own organization, or teaching. We also will be providing a toolkit at the end of this webinar series, which will provide you with links to our speakers, the work that they're doing, the centers that they host, and other toolkits, including working across systems, the medical system, the legal system, and some of the other systems that we're going to be hearing about today. We invite you to ask questions throughout the webinar, and you can put them right in the chat. I will be monitoring the chat, and we'll invite our panelists to join us back by camera later today while we answer our questions at the completion of our program. Next slide, please. The Susan B. Anthony Center works to translate science into practice. Very often academic articles that are important pieces of work get written and they are behind what we call paywalls, and not all community partners have access to academic articles. So our Susan B. Anthony Center tries to get articles that are written and work that's being done, not just from academics, but also from community members, including people with the lived experiences that we're talking about. So we often partner with our community and people with lived experiences to translate across our university, the Rochester community, the state, the nation, and we've been working internationally as well. We'll speak more about that at the end of today. We want to thank very much the Susan B. Anthony team, next slide please, who helped us work on this event. That includes Athena, Ariel, Sid, Sebastian, who held down the fort, John Cullen, and Batula in the Susan B. Anthony Center for bringing their varied perspectives across the lifespan, which we'll hear more about when Martha joins us in her speaking today about how different generations can work together. I'd also like to thank a committee that came together and worked on this. Richard Gelb, who you'll hear from today, was the person who brought these issues to our attention in the form of asking us, what can we do? And he will be speaking today about some of his lived experiences and his work. So the committee included James Brin, Richard Gelb, Carolyn Brusquith, and Tracy from Lifespan. You can see our two or three sponsors, the Aging Institute, Reframe Agency, and Lifespan, who are our organizations that we partnered with as well, and Judge Winslow, who will be joining us later in the series about safety. Next slide, please. And with this, I am going to be turning the mic over, and the rest of us will go off camera. I would like to introduce for you today to hear a little bit about what the University of Rochester is doing in the aging world. Dr. Medina Walpole, she is a professor of medicine. You will be able to read more about her and all of our presenters on our website where their bios are noted. She is the chief of the Division of Geriatrics and Aging and the inaugural director of the University of Rochester Aging Institute. They were one of the first organizations we reached out to. For 25 years, she has had a career as a geriatrician, and she looks at inspiring and educating health professionals at all levels. And again, so important that we're going across generations because people are impacted by who greets them at the door, who helps them in the building, who helps them park. So I will turn it over right now and look forward to hearing from you, Doctor.
Good afternoon. I'm Dr. Annie Medina Walpole, and as you heard, I'm Chief of the Division of Geriatrics and I direct the Aging Institute at the University of Rochester. And I am both delighted and honored to be here today to introduce the first in a series of 3 webinars focused on empowering older adults for lifelong well-being. So this webinar series honestly warms my heart. It is being sponsored, whoops, by the Susan B. Anthony Center and Lifespan, along with the Aging Institute. And the first one is aiming to raise awareness about ageism and the impact on older adults' well-being. You're going to learn about how you can create inclusive environments that value the contributions of older adults. And honestly, that perfectly aligns with the work that we're doing with the University of Rochester Aging Institute. So the Institute encompasses our entire university, including the undergraduate campus and the medical center, as well as our community and across the Finger Lakes region. Our vision: with vitality and resilience, aging adults have the power to thrive. Our mission is to promote vitality in aging by transforming care and communities through collaboration, discovery, and innovation. The Institute impacts all aspects of our university, including research, education, and patient care. And this approach, as well as our outreach to the community, makes us vastly different than most aging institutes across the country that focus primarily on research. We wanted our institute to resonate with all stakeholders. So our pillars, if you will, are vital discovery, representing research; vital care, representing patient care and education; and vital living, which is engaging our community and the older adults themselves. So when we think about aging with vitality, it's really achieving health and longevity. The Aging Institute is committed to promoting health, independence, and engagement, enabling all of us to live our best lives. So I have to do a shout out to Ms. Martha Hope, who's the CEO and founder of Senior Expressions, who's on the panel today and truly exemplifies aging with vitality. So we are working to build a strong research infrastructure that's translating scientific discovery into clinical care. We're asking questions like, how and why do we age? What factors determine longevity, lifespan, and health span, which is the period of time that an individual remains healthy, not just alive? And then what interventions can we offer to optimize an older person's health, well-being, and vitality? And then finally, can we control the aging process itself? This could be viewed as the ultimate preventative medicine if we could modulate the aging process. So really exciting work going on in Rochester with regards to research. For vital care, we're working to increase access to high quality geriatrics care, as well as remain a leader in workforce education and development. And finally, we are working very hard to disseminate the age-friendly health system. That is a talk in and of itself, but I had to share this slide because I'm so proud of the work that we're doing in really transforming URMC. So this shows how our hospitals are obtaining certification. We're educating our nursing homes, Monroe Community Hospital, our home care program, even our Eastman Institute of Oral Health. We are the first dental clinic in the country to become certified as an age-friendly health system. And we just learned in the last month that our Center for Perioperative Medicine is also the first in the nation to receive full recognition. So again, we are extremely proud of these efforts, and the Aging Institute is leading this charge. When we think about Meliora, this is the university motto: it's ever better. And what we believe that aging should not be viewed as a time of decline. It should instead be a period of life where people can pursue new interests, new opportunities. And as this said, Meliora needn't end at 65, 75, 85, or even 100 years of age. So we're offering lifestyle interventions to promote vitality and aging, developing new community partnerships, and we're working very hard with our community partners to make Rochester the ideal place to age well. And ultimately, we'd like to develop an age-friendly community and an age-friendly university. And so the possibilities are truly endless. So I really believe the future is bright for geriatrics and aging in Rochester and our university. And this webinar series is just one example of the amazing work that we are bringing to you, our community, and also to the nation. So to learn more, you can hold up your camera to the QR code, and we have a full website. So I'm going to end here, and thank you very much, and enjoy the webinar.
Thank you so very much for your presentation, and we are providing the link in the chat, so you all have it handy to save it on your computers should you hope to do that and didn't have a chance to snap that QR code. Sometimes I'm not as fast as I'd like to be. Thank you so much for all the work you do. Enjoy your next event. I know you're on a tight schedule today. We thank you for being here. I'd like to introduce our next speaker, Patricia D'Antonio. She joins us from very interesting position as Vice President of Policy and Professional Affairs for the Gerontological Society of America. She is also the Executive Director for the National Center to Reframe Aging, and she has more titles than I can say. I hope she doesn't have as many offices and phone numbers that go with that. We are excited to hear what she has to share with us today, and she will be providing us with information on initiatives that are focusing on policy and organizing in the aging arena. I also like the way that they term aging arena as opposed to some of the other terms that are used, which is great. And interestingly, you come with us to us with a background in pharmacology, which I think is interesting around the different roles that people play in the work that we do. So with that, I will hand it over to you. Look so forward to hearing your presentation today.
Well, thank you so much. I'm really excited to be here to be able to kick off the series with Martha and with Richard. So really appreciate the invitation. And without further ado, why don't we get started? I want to tell you a little bit about the National Center to Reframe Aging, something that both professionally and personally is important to me, to the Gerontological Society of America, which is a international professional membership society of colleagues who are working in research in aging and education in aging to advance practice and policy in aging. This program and this project is led by the Gerontological Society and supported on behalf of 10 national aging organizations. And really what we are dedicated to is ending ageism by advancing an equitable and complete story about aging in America. This started roughly 10 years ago with the executive directors of these 10 organizations. So organizations like AARP or US Aging or Leading Age. You would be quite familiar with some of these organizations based on where your practice is and where you are engaging in either research, clinical practice, community-based services for older people. The executive directors got together and said, you know, what's really holding us back when we're trying to get policy passed, policies across the finish line? And really what they came down to was saying we need to conduct some research to understand what it is, how it is that the public understands aging and supports those programs that help us all and benefit us all as we age. So with the support of philanthropic funders, as well as with working with our research partner, the Frameworks Institute, the Reframing Aging Initiative was born. And from that, as we learned more about what we should do to teach people to learn more and develop communication strategies about aging. So how do we communicate about aging that supports a productive understanding of aging in America? The National Center to Reframe Aging was established 2 years ago in 2022. The center is a trusted and proven source for these communication strategies. Today, my goal is to go through some things briefly with you, but there are strategies behind this for how you can start to think about the ways that you support that productive communication about aging. So if we go to the next slide, I think it's really important that we all think about and level set how we understand ageism. And what we're talking about here is the World Health Organization's definition of ageism. And in fact, this decade is the decade of healthy aging as established by the World Health Organization. But some things to think about is recognizing that ageism exists in several forms. right? So it's how we think, how we feel, and how we act. And it exists on multiple levels. And so, as an example, an interpersonal experience we may have is somebody just calling out and saying something quite ageist, like, oh, you're too old to be involved in this marathon, or you're too young to be running this department. So it is a life course issue, ageism. It's not only directed toward older people. Our program, our project, and our center focuses on older people because we do think what we've recognized is, and there's research to support this, that that ageism impacts our health as well as our well-being. Compassionate ageism, you may have heard this or experienced this when someone often uses terms that we call elder speak, like, oh, sweetie, that's okay, you're fine, you don't look a day over 50. Or institutional ageism, where we have social norms or rules and regulations that may unfairly restrict opportunities, like people are not promoted past a certain age, or forced age retirement simply because of a chronological number, not taking into account our functional age. And then, of course, there's self-directed ageism that we all experience. I have this pain in my back. I guess it's because I'm getting old, right? Well, we know that you may have, and we accept that you have a pain in your back. We also accept that you are aging, right? The two are not related completely. You need to go get that checked out. And someone can have a pain in their back at any age. If we go to the next slide, you'll start to realize that, you know, the thing is that ageism and how we start to form our opinions about aging start at a very young age. And it's no wonder, you know, the jokes that we tell or the jokes that we hear, some of the things that we see on television shows or in movies about how an older person is portrayed. And some of the things that maybe we hear and we continue to perpetuate ourselves. And so one example that I would show you here is in the middle, the pictures of a birthday card, right? Where else would we think it's okay to make fun of somebody? And we're not only making fun of this person's age, but if you notice, one of the women appears to have a disability as well. And so we're making fun of age and disability for this person without even giving it a second thought. And in October of last year, the New Yorker featured our congressional leadership all walking with walkers and portraying them in a way that really does demonstrate decline, disability, and death. And as we all know, as we age, that we become much more different as we age. And yes, there are some people who have multiple chronic conditions, are experiencing frailty, and there are some people who are able to go on cruises and jump out of airplanes for their 80th birthday. And there are a lot of us in between. And that's the important thing to think about. If we go to the next slide, what you'll see is that our colleagues at University of Michigan conducted a poll, and what they found, that they interviewed people aged 50 through 80, and 82% of the people interviewed experienced one or more forms of ageism every day in their day-to-day lives. And some of that you can see is exposure to ageist messages. Some are those interpersonal interactions that we all experience, and some is that internalized ageism. So while I could sit here and make you all sad about this, if we go to the next slide, you'll see that, you know, some of this is around our subconscious, or those stereotypes that we carry in an unconscious manner. We don't even realize it when we're making some of those assumptions about age that contribute to this incomplete, I would say, picture of aging. What we learned is that through our research and through some of the communication strategies that have been developed through our research, that when we make people aware, just simply being aware of implicit bias does reduce ageism, which is our goal, right? To get people to think much more completely and much more productively about aging. We can go to the next slide. And let me just share that within this slide, a couple of things that we learned in our research. And our research was conducted across the United States, a representative sample. Some of it were questionnaires, some were interviews, some were people on the street interviews, some were focus groups. But public perceptions about older people are somewhat unrealistic, right? This is what we learned in our research, that it's somewhat unrealistic. Like I was saying, there's this thought that either everybody's living the high life and going on cruises, right? We're all on vacation, or we're all frail and decrepit. And if I was live in person with you, I would start to hunch over. Just assumptions that people make about that. And even the assumptions about someone making that, the assumption you may make about someone's physical appearance doesn't recognize being able to participate in society and contributing in society when we think about physicality impacting our mental health, our brain health, right? What also we learned was that ageism wasn't considered a problem. And of course, we were able to walk down a birthday card aisle and purchase cards that perpetuate ageism. So where else would we be able to do that? When you think about that, ageism, in the workplace isn't a problem because we have rules against that. We have laws against that, right? And then what we learned is there are deep-seated, or we know that there are deep-seated ways that we make split-second decisions when we hear or see or participate in communications related to older people. And so how we are able to understand and interpret those experiences very quickly as we're hearing, watching television, as we're reading, we might be reading a piece about aging. Those automatic assumptions, we take for granted that people understand what we mean when we are communicating about older people, when we are communicating about aging. So in the next slide, I can show you some of the questions that we asked and some of the things that, I think when we conducted this research, we had people who are working in the aging field, people who are experts in this area that we interviewed. And then we had members of the public. Now, remember that those of us who work in aging, we are also members of the public. So at times, we may actually contribute to some of the misunderstanding and the incomplete discussion around aging. But let's kind of just take a look at a couple of these questions for time's sake. So one question that we asked, when we ask people who work in aging, is how should we approach aging? We embrace aging, right? We think it's fantastic because of all the contributions in science, we are able to age longer, we are able to age more healthfully, and we're trying to work to address our well-being, right? We know that there are things that can be done. Whereas if you think about this in the public, we battle aging. And in fact, on some of the videotapes that we have, we not only hear someone talk about the battle, we see somebody talk about the battle by pushing away when they talk about aging, by raising an eyebrow very critically when we talk about what does it mean to grow old. The other thing is what I mentioned a little bit earlier about the concern for ageism. And in the aging field, we recognize that this can really be detrimental. It's an important concern for all of us, because of how we continue to think about ways we should support us all as we age. And those programs and supports, Meals on Wheels is a good example. Those programs and supports actually benefit all of us, right? We benefit not only not only us as we age and the person that the meal is delivered to, but also think about caregivers and family members who are also supported with programs like this. What we learned in the public is it was just absent from thinking. And so when something's not part of like how you're thinking about aging, it really is easy for us to think about the more unproductive or negative cultural models that come to our minds right away about aging. And what we call this in the next slide is what we call this is you say, they think. So we're in a group of people who we work with regularly, who understand what we mean. And when we say things like the elderly, what we know from our research is it draws people to think that split-second decision about somebody being frail and dependent, right? And that's not what we are trying to portray in a message when we're talking about older people. What we really want to do is start to get people to think about how we are all aging. In the next slide, we talk about that. And when we use phrases like we are all aging or all of us as we age, we start to recognize the collective responsibility and benefit that we all have related to our communities and how this thinking gets us to start to work together and benefit together. So I could tell you a little bit more about our research, or I could show you a video. And so in our next slide, we have a video to start to understand how we can think about aging. And Sebastian, if you don't mind starting that video, I'd appreciate it.
What do all these people have in common? Every day, they're doing something that we're all doing too, getting older. Aging is a universal, shared experience. But the way we talk about it can diminish and harm older people, even when we don't mean to. It's phrases that casually equate being older with being less valuable. It's imagery that too often portrays older people as needy or isolated. There's a better way to communicate about aging. We can stop othering older people by talking about us instead of them. A them statement segregates and blames. For example, older adults are a challenge for our healthcare system. They make a lot of demands on a system that is not prepared to care for them. An us statement is inclusive and helps all of us see ourselves in the issue and in the solution. For example, we need a healthcare system that is built to help all of us live well as we age. When choosing photos, images of diverse older people interacting with others send a more inclusive message. When we shift from them to us, we promote a more realistic, inclusive view of aging, reduce bias, and build support for policies and programs that can help all of us at every age. The Reframing Aging Initiative provides free evidence-based tools to help us get there. Learn more at reframingaging.org.
So this is part of a series of videos that we have developed called the Frame of Mind series. I would encourage you to go to our website, take a look at more. There's certainly so much more. In 15 minutes, it's enough to be able to, I hope, get you to start thinking about how our communications really do impact all of the work that we do. I think it's fantastic how we learned about the work of Rochester and the age-friendly health system and age-friendly communications is at the center. When we think about the spokes of age-friendly universities and age-friendly communities and age-friendly health systems, at the center of all of that is how we communicate and that age-friendly communications. So I invite you all, we have some information here and I'll be sharing additional information if we go to the next slide to recognize how those positive perceptions of aging are priceless. So thank you so much and look forward to your questions at the end of the presentation today.
Thank you so very much for that. And as I was listening to you speak, I was loving the concept of spreading your framework and ideas to lots of different marginalized groups, this notion of us versus them and how polarizing simple language can be. So thank you for that reframe, even though you call it frame, I guess. And I do look forward to hearing questions and answers as they come in over the remaining of the webinar. We are going to switch gears a little bit, and I am going to be introducing someone who I have known for a very long time, Martha Schofield Hope. We have been on a couple of committees together, and I don't really know where to start with her introduction, so I'd like you to read it online as well as the others. But Martha has worked in the human service and community outreach for over 50 years, and as she states, most of her adult life, 25 years of that as a health counselor and an advocate. And you heard that she's involved with some of the organizations that we're speaking about today as well. I think what is quite fascinating is that after retiring from the Monroe County Health and Social Service Department, Martha and her husband went on to become foster parents and adoptive parents and adopted 5 children that had been placed in her home, which is a remarkable story that I feel like we need a webinar series on in and of itself. Also, most notable, there was an organization started by Susan B. Anthony in 1898, and that is our namesake of this organization that we work with that's bringing you this today in conjunction with our partners. And that organization was the Rochester Federation of Women's Clubs. And Martha was the first African American woman to hold that position. So I will turn the mic over and hear about her thoughts of working across generations and what ageism looks like and some of her lived experiences. Thank you so much for being with us today.
Thank you, Catherine, so much. I don't know really where to start, and I just think that I'll start with the organization Senior Expressions, and that particular organization came out of my own challenges with being lonely, and the organization was supposed to be about dealing with isolation and loneliness, but it seemed to have branched out into something quite greater as we do the research, as we go into the community to work with, I don't want to call us seniors. I just had my 80th birthday. And so I call myself a senior, a seasoned adult. So it all came about, as I said, losing my husband. We were childhood sweethearts. And actually, as of last month, had he still been living, we would be 61 years married. And I now live with my adopted daughter, something it took me a long time to actually decide that was what I should do after my own health challenges. But ageism for me is they've kind of just almost cursed us, and we accept it. That's how I see it, and that's how I understand it. But we really don't have to do that. After you get 50 years, you think you're going downhill. Well, we're not going downhill. I know that there's a lot of things that are connected, serious health problems and that kind of thing with loneliness. And as I did one research, well, a couple, but research is 30% of people 45 years and older are lonely. And that for me is disturbing, because I know what happens when you start to get older and you lose your friends, your family, you no longer work. If you're 65, they want to get us out of the workforce, but we have contributed lots of things to community and to life. And I guess what Senior Expressions, I want seniors to be able to express themselves. And I tell my family all the time, don't try to tell me what to do. We as a people need to get out into the community and ask us what it is we need, what it is we want, what are those things that are challenging for us. We just did a focus group on seniors, and it bothered me because I can identify with some of those things, and technology was a big deal. And as I said, it started out that we were going to deal with programs that would bring people together. And we did fishing games, and I don't like fishing, but fishing was a big deal. We did gardening. We did trips to the Threador, that kind of thing. We went down to the Festival of Lights for Christmas. We we did a production. We went down to production in Lancaster, Pennsylvania for the biblical play of David, and it was excellent. We only stayed one night, but I want older people to know and that we have contributed, and it's okay. It's a gift to be able to age. I know it that way, but it's a gift to be able to age. And so my thing is, I would like for all of these services to come together sometime, and we as older adults or seasoned adults, that we be a part of that. We be a part of the planning. We would be a part of getting things together for us. I don't feel that someone should just come together and decide what it is that should be for me. And I'm dealing with that right now. It's not anything serious, but I said, if I am having some health challenges, but if I feel like driving, let me drive. If I feel like doing this or that, let me do that. And I understand it, but I just feel that it's not fair to us that have contributed in the community, on our jobs, in our family, and then we're kind of tossed to the side. Sometimes it's almost like we're invisible. I'm thinking of, I have an excellent doctor though. I'm just thinking about my doctor and comparing it to what I had to do for my mom, that they just kind of talk to you and use language that we don't understand. But if we could start to build, and when I say build, I mean not be ashamed of growing older. It's really not a curse. It can be a gift. And I know that loneliness and isolation, those kind of things cause many, many problems. Depression, Alzheimer's, heart trouble. There's all kinds of things that loneliness and isolation. So we have tried with Senior Expressions, and that's why I call it Senior Expressions, so that we will understand that we have a voice. I want to give Senior Expression wants to give older people and seasoned adults a voice. So technology has been an issue. So we started a technology digital program at one of the inner city rec centers. It's only for an hour and a half, because as older adults, we don't want to do things too long or too late. So, and that is going pretty well. We don't have a lot of participants at this time, but enough to do that we can work one-on-one. And guess what? Martha Hope is one of them. And so it's just a wonderful thing that if we could ever come together, community, organizations, and institutions, if we could just come together and work on together with older seasoned adults on those committees to give our voice, to give our opinion of what is good for us. So it's been a wonderful journey. I am so excited. What we do is a senior ball. I did a that we started out. You'll be surprised of people that have not been on Canal on a cruise. So we did that, and then the next year it was during the COVID era. So 77 senior ball, people and see your old friends, and then we dress people and acknowledge those people that have been working in the community for. So it works out very well. We are now 30 people. I have to be where I am this year. I have to move. So it's all about. Thank you so much for your time.
Oh, thank you so much for those inspiring words. And I love the idea of a ball so much. And sorry to all of you viewers, we had told Martha we may need to turn her camera off as she was having some technical difficulties earlier. So that is why we lost the feed to the camera. We will hear more from our speakers in the Q&A. I do have some questions that are available for us to ask. If you have any additional ones, please feel free to put them in the chat. I am pleased to introduce right now our final panelist, Richard Gelb. And again, I mentioned earlier that Richard was the person who brought this to our attention, related specifically to what was U of R doing in this space. And he was referred to the Suby Center from some people in the other parts or divisions of the hospital and the university. So Richard is a cancer survivor, advocate, and educator, and he is also a caregiver. And I wanted you to hear a little bit about his advocacy on cancer aging research, because there are often groups within an illness that get put on the margins, or people don't necessarily think about groups that are disenfranchised. And also he is part of what's called the Caring Scoreboard member. Caring Scoreboard member. He's also a community representative at Yale New Haven Hospital, so colleagues of his also helped us with this. So I'm going to turn it over, and Richard had a fairly compelling story when we were on the planning committee about a typical everyday experience we all have. I, in fact, had the experience last week, but we all don't walk away from it in the same way. So with that, I will turn it over to you.
First of all, I'm really honored to be invited and be a speaker. The University of Rochester is one of the leaders, if not the leader, in geriatrics. So this is really a wonderful opportunity. I was going to speak today and share a personal story that is the best way I feel to communicate my feelings about ageism and growing older. And just coincidentally, I was checking my emails, and I had an email from the Atlantic magazine of 9 books about aging, growing, and changing. And a quote, "Living in a body is an exercise in enduring surprise and accepting change." And so my story, last week I celebrated my 85th birthday. And the message I want to communicate is that I've learned to really move from my comfort zone and open myself to new experiences. And so on this trip, we took a vacation trip to celebrate my birthday to Portugal. And so for the first time, I used the wheelchair services to be able to manage traveling to the different, in the airport to the gate. And I was very much aware of feeling uncomfortable, how people would be looking at me. But again, accepting my age and some physical limitations, but I was very much aware of my own feelings as I was going through the airport. Also, this was the first trip that I was not driving. We Ubered between different cities and hotels, and really to understand emotionally how that felt. I had many years ago had to ask my father for keys to the car because he was having trouble driving, he was having accidents. And so here I was now having to accept that driving was too much of a challenge for me. But again, making a decision that turned out to be very good. I was under much less stress and I think had a better time. Also, I was reading through some of the materials about the intergenerational understanding. And on the trip, we had opportunities to have conversations with several young people, Portuguese young men, who were working in the hotels, who were in their early 20s. Now, ordinarily, I would not get into a conversation with a person that young. I feel uncomfortable. I would feel they have other things that they're interested in. We had a wonderful conversation with these young men about their careers, about their work experience, their education, etc. And again, it reminded me that moving from my comfort zone is a way to learn and is a way to communicate to other people that I'm just like anybody else. I may be an elderly person, an older person, but I can communicate and I can have a story to tell and I can listen to their story. And it was liberating. It was wonderful. The last story I wanted to share was we had become friends with a young man who was the supervisor in the restaurant in the hotel we stayed at. And when we went to the restaurant, we didn't see him. And one of the staff came up and said, Eduardo is on medical leave. He's just been diagnosed and had surgery for testicular cancer. We were really emotionally taken aback and really felt upset about this young man having this experience. I'm a cancer survivor, prostate cancer and melanoma. And my first wife died of transitional cell carcinoma on a reoccurrence. So emotionally very much connected to people's cancer stories. The assistant to the general manager said, why don't we make a video for Eduardo wishing him well? To make a long story medium, as my wife often says, we made the video. Eduardo was so happy with the video that he came in the next day to share with us his good feelings and to have a very, very personal conversation about his cancer journey. And here again, moving out of a comfort zone, willing to make a change, and being open to change is the message that I want to communicate. That my chronological age is just, that's what it is. Yeah, I'm more than that as a person. To divert for a moment, Kate was referring to, which I think all of us have airport stories, but prior to this trip, we had been at the airport in California to rent a car. And the experience was we were changed around from one desk from the other, going back and forth and really feeling like, as we looked around, that we were suffering from the bias about elderly or older people. And what we had to do was advocate for ourselves. We had to speak up. We had to ask for a supervisor. But in the end, we were wondering, is it about us, or is this just the usual way that people are treated in our society? I think it's a combination of both. And to segue in, it brings me to the next point, is that we have to learn we have to become educated about ageism, about illness, about the healthcare system, and then we have to become advocates. It's our job. And we've done numerous workshops and orientation centers that it's a job that we really have to take on the responsibility. And you can advocate for yourself, you can advocate in your community, you can advocate on a political level. But it really becomes our job to become knowledgeable about ageism, about illness, about disease, about our own health, about the healthcare system, and learn how to communicate. And one of the ways I've found is to share the patient or the elderly person's perspective. And my feeling is that just being in the room, just representing the community speaks volumes, that you're being there, and it may take time till you're recognized, but eventually it's going to come. You'll be able to share your perspective. And again, just get out of your comfort zone. I'm looking and thinking about, I met Kate, I met Martha, I met Trish, I met Sebastian, I've met Allison Magnuson, who's a cancer and geriatric researcher at University of Rochester. So my life has just been expanded. At 85, I'm still growing and still learning. And that's my message. That's my personal story. And I just am so happy that I met Kate and we started this journey. And here I am sharing it with you all. So thank you for listening, and be well.
Well, thank you so much. Don't go anywhere. I do have some questions. And thank you so much for that. In listening to our three panelists today, along with the Aging Institute's work, it brings me right back to the University of Rochester being an organization where biopsychosocial care had its roots. And really, when we think about aging, considering the whole person, what are their social needs and what do they have to offer socially? So one of our questions was, and if each of you could just answer, briefly, or feel free to put resources in the chat for us. One of the questions that came in is that when people retire, they often have so much to contribute in the way of a skill set, knowledge, lived experience. How do we connect this wealth in our seniors to the desperate needs in our community? And Martha, you're starting and you've been doing that work for a long time. But for somebody who's on this webinar who either feels that they have a lot to contribute and maybe they're older, or is younger and feeling like they need help, mentoring, coaching, anything that maybe a person who's a little bit further on the track could help them with, how do you think people can connect in that space across the divide a little bit more, not just in Rochester, but nationally? And I'll start with,
But there's,
go ahead, Martha. I was going to say,
that,
start with Martha.
Catherine, is that for me?
This question's for all three folks, but yeah, if you want to start.
Oh, I see. What I'm talking about. There are many organizations out that will assist in planning after you retire, and what we do with Senior Expression, go into the high rises and the community people planning and retiring, of making that contact. And there are organizations out that somebody wanted to contact me, I would be glad to different places.
Sorry, there was a little delay there. That's great. Thank you so much. So you've got someone on the line, everyone who's listening to us that's willing to help kind of foster some of those connections. Trish, let's go to you next. Do you know of any matchmaking organizations that help people connect? And Jim joined in, who was on our committee, to say volunteering is such an important part of life. And how can seniors connect with organizations they might want to volunteer with? Or how can organizations reach out to the people who are aging to say, hey, we need you, we want you? So do you have any national hints for us? And we can drop those in the chat. Perhaps John Cullen, if you could be doing that, that'd be great.
Sure. So I think one thing is to remember that intergenerational activities are probably one of the best ways for us to reduce ageism across the life course. Better understanding of older people, better understanding of younger people comes from those types of activities. One organization that I think is fantastic to think about, we all know about AmeriCorps, the AmeriCorps program. Well, there's a portion of that program that is AmeriCorps Seniors, and has a variety of programs around the country, and helps connect older people with volunteer opportunities within a community. So I think that's one great place to get started. And there's some established norms and some established activities. So it's not kind of, it's more like you express your interest and they're able to help connect you, as opposed to, well, I don't know, what do you want to do kind of an activity. So I'd highly recommend AmeriCorps Seniors.
Well, thank you so much for that. And Richard, just quickly before I move to the next question, do you have a go-to organization nationally or community-wide that will help you help connect seniors and, sorry, 8 people aging to volunteer opportunities?
I don't have a link or a recommendation in that respect. I think it's a lot of work at finding a good fit. And I think you just have to get out there and, as I said earlier, move from your comfort zone and try different organizations where your skills are appreciated. It's a long journey finding the fit.
Yeah, it is. And sometimes you find that fit because of something you've gone through personally or a family member's gone through. I'm gonna put the next question out, but I'm gonna ask you to think about it while I wrap up with the last 2 slides that I have. I'd love each of our panelists to close us out with a sentence or two that they would say to their younger self as they're growing up, thinking about their futures and where you currently are now. So if you could say a sentence or two to your younger self about the process you've gone through in either working with people who are aging or yourself with your lived experience. I am just going to wrap up before we go to our panelists for their closing words. First of all, thank you so much to our community partners once again and our committee. Next slide, please, Sebastian. At the Susan B. Anthony Center website, you can see various manuals that we've put together for our younger people on this, how to get through the law school process. A student who worked with us produced both of these on what it's like to live at U of R and try to help students that are coming in and juggling different transitions in their lives. So those program books are available to you. Next slide, please. I also want to invite you to keep your eyes open for Mel Weekend. We will be partnering hopefully with Mount Hope Family Center that is currently running the Transform Center, and very interestingly, work being done by Dr. Manley and her team on the impact of child abuse and neglect on the aging process and sometimes early aging processes. So keep your eyes peeled for that work, which will be happening in October. Next slide, please. And I will close with the quote, human progress is neither automatic nor inevitable. Every step toward the goal of justice requires sacrifice, suffering, and struggle. The tireless exertions and passionate concern of dedicated individuals by Martin Luther King Jr. And Sebastian, you can stop slide sharing for me. I just want to wrap up on that quote for all the people who are our panelists for your tireless work on behalf of others. And with that, I will go to Martha. What would you tell your younger self?
Tell my young grew up in a traditional, and we honored our elders, but our elders kind of, so I would say that I am enough to get, but I would say that I'm enough and I would have achieved some other things that I wanted to do in life.
I love that. I am enough. We are enough. You are enough. Trish, what would you tell your younger self?
I would remind myself that I'm on a fantastic journey building wisdom and knowledge that I can share with others as we age.
I love that. Richard, what would you say to your younger self?
Welcome and embrace change. Be kind and ethical.
Oh, that is just beautiful. A beautiful way to wrap this up. And Jim did recommend that we think about community foundations that are local. Sometimes they can help introduce us to organizations they are sponsoring that provide compassionate care and help in the community. So that is another resource if you have a local community foundation. With that, I am going to thank our panelists, again, thank the Susan B. Anthony Center, and thank all of you for being here. And with that, we will take it as a wrap, and we hope you'll join us the next 2 Mondays. Have a great day, everybody.
Bye-bye. Thank you.
Thank you.
Thank you.